My name is Alyssa Koval Gardner, and I'm here to discuss my testimony in favor of Bill H.2120, which is an act relative to mental health needs and suicide prevention in Massachusetts. My background is in healthcare for the past 6 years, mostly working in outpatient services. And I am currently enrolled in the healthcare administration program at Regis College. I've also been a lifelong resident in Massachusetts. So basically what this bill would do is create a commission to examine, report on, and improve on mental health crisis and suicide prevention in Massachusetts. This commission would include 7 members or their designees, which would be the governor, the attorney general, the secretary of health and human services, the commissioner of the Department of Mental Health, the commissioner of an executive office, public safety and security, the Speaker of the House and the Senate President. Some of the areas that the commission would examine would be emergency and outpatient care needs, inpatient and long-term care needs, facility and infrastructure needs, public information and outreach, professional training needs and potential shortages, and then establishing a dedicated fund suitable to accept donations from charitable organizations in regards to mental health and suicide prevention. This also an aspect of this bill would be to create a friends and family suicide prevention hotline. This would also include a wellness program follow-up for anyone who needed services after reaching out to the hotline. So basically this would give a resource to friends, family, those affected to get confidential assistance who are experiencing a mental health crisis. Currently in the United States, 1.2 million people have thought about suicide, and suicide has totaled to 45,979 deaths within the year 2020. Specifically in Massachusetts, 618 suicides were reported in 2020. So clearly this is a huge issue in the whole country and in Massachusetts. And specifically post-COVID-19 pandemic, there's never been a more important time to implement mental health and suicide prevention programs and outreach. The COVID-19 Community Impact Survey was released by the Department of Mental Health in Massachusetts, and this found that 33% of people reported poor mental health within the past month. And it also found that some special groups were more affected by mental health than others. And these groups included LGBTQ plus community members, those with disabilities, multiracial groups, younger respondents, and lower income groups, and those with lower education status. Also within the past, or within September and November of 2020, McLean Hospital saw a 30% increase in outpatient mental health services utilized, and Boston Medical Center reported a 131% increase in ambulatory psychiatric department volume, and that was compared to 5 months prior to the onset of the COVID-19 pandemic. Clearly, the combination of a disruption of people's lives, fear of infection, global economic crisis, and grief surrounding deaths within the COVID-19 pandemic have kind of created this quote unquote perfect storm for a mental health crisis, especially in Massachusetts. So I thank you for listening to my testimony. I am in favor of H2120 to hopefully move forward in preventing and giving people the resources when it comes to mental health crisis and suicide prevention. Thank you.